Well, before I leave the office for tonight, I wanted to share with you information once again about a sad Syntonics story. Before I do that, let's tell you how you can connect with us. Our phone number is 618-288-1489. If you're local to us, give us a call. If you're not local, that's okay. You can go to our website at visionforlifeworks.com and you can schedule a consultation directly from that page, or you can look around that information and also take a questionnaire. Now, let's tell you about this sad story. It revolves around two pairs of glasses in Syntonics. Red, which I'll show you, and then green. These are super common filters. Hopefully you can see that translated in the video. That's the red one. It's really dark. And then here's the green one. Really, really common filters that are used in Syntonics. And in fact, if someone does Syntonics and they're using this to treat their patients, most of the time they're going to be using these red and green glasses. And I know this because I get a lot of patients who say, well, I did Syntonics with another office. And I say, well, what filters did you use? Red ones and green ones. Like, did you use anything else? Nope. And that's the answer that I get probably about 80 to 90% of the time. Probably 90% is more accurate. So here's a tale of a situation gone wrong. I consulted with a patient probably about a month and a half ago who had gone to therapy with another office, and she had done Syntonics only 3 times. She had a lot of symptoms. Headaches, dizziness, nausea. She was experiencing like visual vertigo. She had what she considered to be visual snow, which was like staticky vision and even some floaters. And so she started therapy and Syntonics at another office. What did they prescribe for her? Well, they prescribed the red filter for 10 minutes and the green filter for 10 minutes for her to wear. So in total, 20 minutes on these filters. Now, the red filter is actually meant to balance out the sympathetic nervous system and the parasympathetic nervous system. However, if you have someone who comes in with these complaints of dizziness, nausea, headaches, or they can't even focus to drive, they're barely getting through their day, you probably don't want to start them with this filter first. And you definitely don't want to make them do it for 10 whole minutes. Well, needless to say, within just 3 sessions of doing this 10 minutes and 10 minutes with both of these filters, she felt like her symptoms were significantly worse. And not only that, she was basically in tears by the time that I connected with her, saying, I'm a young mom and pregnant with another child. I can't really have this happen. I have to have a life, and so I need to be able to function. And she took it very, very graciously, to say the least. But the problem is that there was really not much given to her in the way of instructions. She said the other thing that was really, really frustrating, she didn't know what light to look at. She didn't know if it was supposed to be light in the room, dark in the room, how far away from the light she should sit, what type of light bulb it was, should she even wear her contact lenses or her glasses while doing it. She had no instructions at all other than 10 minutes, 10 minutes. That's it. Well, that's a big problem. So one of the things that we do is that we have a lot of forms that we fill out for our patients. And I have this little book that I use post-consult in office and online. And several of the things in here, one of them is a sheet that is going to say all the filters that we're going to prescribe for a patient to use during the course of their treatment program. And then we also give a consultation summary. And then the last one here that I want to share with you is really important, because this particular page is what's called our Syntonics Phototherapy Treatment Protocol. Now, I have since started calling this a little bit more specifically neurological light or neurological stimulating light therapy. And the reason why I've made this switch over to saying this is that we're just saying Syntonics or light therapy. This sounds like something that everybody does. And it sounds like you can just go on Amazon and purchase a light box and stare at that. Or you can just get a pair of glasses that have a color filter or a colored lens in them, and that should be good enough, right? Well, the answer to that is not really, and wrong. That's not right. So we actually have a protocol sheet that tells you exactly what to do, what filters to wear, like lots of detail. There's in here even telling you should monitor your pulse whenever you're doing syntonics. We tell you where to look, what light, how far away to sit from it, what type of bulb, all of the nitty gritty details that you should want and more. We also have a video that we share with our patients, which is a step-by-step instructional video telling them exactly what to do. So we hopefully don't want those situations where people say, I don't even know what to do with this. Now, sometimes that does happen, and we just have to gently remind them that they have the sheet and they also have the video to watch. But for the majority of our patients, once we provide this information, they pretty well feel set with what they need to do. And again, there are some that need a little bit more hand holding and directions, and that's okay too. But we don't want our patients to feel like they don't know what they're doing. And so we just need to communicate differently if we do have someone that even after we provide the sheet and the video, they're still kind of questioning things. But here's the second part to this. And really maybe, I don't know, it's the main part, but it is a strong component, is that we just don't believe that we want to use Syntonics for 10 minutes per filter for anybody, no matter what the situation might be. And the reason why is this is super strong. It is stimulating the neurological system. You know what that means? It's stimulating your brain. It's like hooking your brain up to electrodes. And for someone to just go like, let's just zap your brain, okay? For anyone who's watching this, who's a doctor, who does Syntonics, who's going to get really ticked off at me and put nasty comments down below, which you do in some of my other videos, I'm using these terminologies and these words just to be kind of funny and to make light of it just a little bit. So don't hate on my comments, please. So, okay, hooking up electrodes to zap the brain, and we're just going to just do that for 10 minutes. That's a lot of stimulation for someone who is neurologically already overstimulated. When they come to you saying they're nauseous, dizzy, have all these symptoms, they're overstimulated. Now, I will tell you, there are some patients, even to the best of my ability, and I call them my 1%ers, that even to the very best of my ability, and I'm trying to go at this gradual and slow to change their neurological system, they may still have some sort of a negative reaction to what we're doing. Is it the majority of our patients? No. And most of our patients, about 99% of them, should feel like they don't really feel anything, or they start to feel gradually and slowly better. If I have those 1%ers again that say like, oh my gosh, this is too bright, my symptoms feel like they're worse, then I'm behind the scenes going, okay, well, what do I need to do? How do I need to alter this? I should know that, however, within the very first week or within like the first 1 session to 2 sessions if they're having that problem. And so we weekly communicate with patients. What they do is they send me a weekly email telling me how they're progressing with this, because they're doing this in phase 1 where they're not actively being seen by our therapist for therapy at that particular time. And so in phase 1, which the therapy part where they're working actively with a therapist, is phase 2. In phase 1, they're doing this on their own at home with the Syntonics, with the sheet that we've given them, and which is their protocol sheet, and also with that instructional video they have to watch. And then weekly, they submit certain pieces of documentation to me so I can monitor how they're progressing. So you can see that with a well thought out system with several pieces of, documents, videos, and other things that happen, that this sort of case that I consulted with really shouldn't be happening. Now, again, we do have those 1%ers who tend to have a neurological system that's misbalanced, and they may overreact to any kind of stimulation, and that's okay. We have to determine that, figure out what our next course of treatment is, or alter the plan a little bit. Maybe if I say, most of my patients tolerate 2 minutes with that filter, but you're so sensitive and your neurological system is so unbalanced that we maybe need to do only 30 seconds of treatment with that filter. That's a far cry from 10 minutes. And let me tell you, it does make a significant difference. The other thing is that we might not be able to go in with our guns blaring on some of these things that we're doing. So we can't necessarily just go in there right away trying to attack a specific problem. Some patients actually need to have their nervous system calm down first, and that would require a different set of filters. So again, hopefully you can see from this, we really want to educate people to understand that not all therapy clinics who say that they do Syntonics do it in the way that we would recommend it to be done, which is realizing that these filters are really adjusting the neurological system, your brain, And we have to realize that not only affects your brain, your eyes, but your entire body, chemical output, all kinds of things. Your sleep can be disturbed. You can develop problems with your, like sense of motion or balance and stability with your inner ear. And so, like your vestibular ocular reflex can be thrown off. Lots of things can happen, including affecting your endocrine system if we're using these filters wrong. So it's very important to make sure that the doctor that you're working with is understanding that, or they're not the one to work with if they don't understand those things, and they're just going to tell you, go use this for 10 minutes, go use that for 10 minutes. Again, I understand this might be a little bit inflammatory to some of the doctors who follow me really, really closely. I love you and I appreciate what you do for your patients. I'm sure you do a fantastic job. But when I have to come alongside and clean up someone who's had some really significant trauma associated with Syntonics, what they thought was going to be an appropriate program for them, which wasn't, that's a problem. And we want to just make sure that patients don't get misled and end up working with patients or end up working with people who don't really know what they're doing with Syntonics. So with that, I'm going to end this video. Can't wait to read the comments that happen after this one. So much fun sometimes. Sometimes people just need to relax. But with that, I'm going to say, if you want to connect with us in your local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can either schedule a consultation with us, fill out a questionnaire, or just read some of the stories and some information that's on there. With that, I'll also say, make sure that you have, if you haven't done so already, hit the like button, subscribe to our channel. And if you feel like this is helpful and someone you know is going through this, pass this video on to them. Thank you.